Hi guys, welcome back to the part 2 of the video on laparoscopic colon surgery. What should parents expect when their child is going through laparoscopic colon surgery? First of all, we need a full examination of the entire colon, which would usually mean a barium or a contrast enema study, which are specialized X-rays, and MRI scan may sometimes be needed. And then we would normally have to prepare the bowel. So children with Hirschsprung's would need bowel preparation for a few weeks to a few months, and children with inorectal malformation would usually need it for a few weeks. What it means is that in most of these children, if we do adequate bowel preparation, we can actually completely avoid a stoma surgery. A stoma surgery means we make a hole in the abdomen, bring out the intestine temporarily to divert the stools, let everything else settle down in the distal part of intestine, and then wash it and then do the major surgery and undo the stoma surgery. So it's basically 3 surgeries. Whereas when we do a laparoscopic assisted single stage pull through surgery for either a colorectal or an inorectal, or either a Hirschsprung's or a inorectal malformation, it means that we avoid the stoma completely. And for this, an adequate bowel preparation is a must. Such surgeries take long time to operate, 3 to 5 hours in most cases, and hence anesthetist plays a big role. The parents would be made to meet the anesthetist to understand what to expect. It is general anesthesia. The child does not feel any pain and is neither aware about the surgery itself. The child would normally recover very quickly out of the anesthesia, usually immediately after the surgery. And in this surgery, as I mentioned earlier, through all the cuts that are there, we would remove the diseased colon and a complete reconstruction would be done. After such a reconstruction, there would be some tubes in the colon and maybe in the abdomen as well, which would need to be kept for 7 to 10 days. Till such time, the child may be allowed some liquid diet. Usually soft diet is started only after 5 to 7 days to give some rest to this colon. And once the child starts feeding normally, all such tubes are removed. And once the child passes stools normally, the child is discharged home usually within 10 to 12 days after such a surgery. In the post-operative period, it is very important for us to monitor that this colon is working properly. Whatever reconstruction we have done is working in a manner very similar to a normal person's colon. And if we find that there is any difficulty, then we may offer a stoma surgery, although this is very rare, but we may offer a stoma surgery to give rest to the operated colon. We understand that parents are worried whether such surgeries are safe. We have experience of over 20 years with such surgeries being done laparoscopically and being done in a single stage without stoma. So yes, they are safe. There are some due risks which we take where the entire team, from anesthetists to operative nurses to the ward nurses to our assistants, everybody is on board, and we take a lot of effort to reduce these risks. And by and large, the long-term outcomes are far superior to open surgery with such laparoscopic colon surgery. So my final advice to parents is that minimally invasive laparoscopic or robotic surgery is very well established for a long time for colon surgery for children. Do take an opinion from a well-trained pediatric surgeon in this matter if you're considering such a surgery for your child. And with early intervention and good follow-up, most children will have a normal or near normal quality of life. So thank you very much for watching this video. Please do like and subscribe our channel. If you have questions about such a surgery, please put them down in our comments, or you can do a video consultation with us as well.